Hi everyone, my name is Cherilyn Lobrigue and I am the reporter of chapter 22. It's all about the physiology of obesity. Obesity is the medical conditions that is excess body fats to accumulate to an extent that may have a negative effect on our health. Obesity is defined as having a body mass index, a BMI, of 30 kilogram per square meter, or more than the range of 25 to 30 kilogram per square meter are defined as overweight. Body mass index is a measure obtained of the body person weight by the square meter of the person's height. Obesity is further evaluated in terms of fat distributions around the waist circumferences. For example, to man waist measure of the 94 centimeter or more, and to women is with the measures of 80 centimeters or more likely to develop obesity-related health problems. Obesity is a chronic condition that increase of health problems such as cardiovascular disease, metabolic disease, cancer, type 2 diabetes, infertility, irregular periods, non-alcoholic fatty liver, and obstruct sleep apnea. Also, obesity can also affect to our quality of life and lead to your psychological problem such as depressions, low sleep esteem, shame, and social isolations. Obesity is more common to the women and men because in 2015 the research shows that 600 millions of adults and 100 millions of children are obese in 195 countries. Obesity is caused by eating more calories than you burn through exercise and normal daily activities, such as result of body store will success calories and fat. The common specific cause of obesity include inactive high calorie foods, lack of sleep, and pregnancy. And the certain medications such as insulin antidepressants may also cause obesity. Moreover, center medication conditions such as Cushing syndrome and hypothyroidism. Symptoms of obesity is having a BMI of 30 or more. It can be categorized as a BMI of 30 to 34.9 is equals to obesity is equals to class obesity. 35 to 39.9 is class 2 obesity. 40 or more is equals class 3 class 3 obesity. Talk all about the prevalence of overweight and obesity. Just like we have noticed in the US country, most of them are obese. In a study published that one-third of the world population is now overweight or obese. And there are some differences in overweight and obesity prevalence by a racial ethnicals group. Overweight and obesity are major risk factors for a number of chronic disease, including cardiovascular such as heart disease and stroke, which are the leading causes of death worldwide. One of the example in the last 2 years, more than 900,000 adult of COVID-19 hospitalization occurs in the United States between the beginning of the pandemic. Models estimate that 271,800 or 30.2% of these hospitalized were attributed to obesity. And there are And there are mainly factors that can contribute to excess weight gain, including the eating patterns, physical activity, and sleep routines. And this is the chart example of the prevalence of obesity and overweight for the adult age 18 years and above. And here's the key factors about the obesity. Worldwide obesity has nearly doubled since 1980. In 2008, 1.4 billion adults aged 20 years old older were overweight. Of these, more than 200 million men and nearly 300 million women were obese. 35% of adults aged 20 and older were overweight in 2008 and 11% were obese. 65% of the world population live in the countries where overweight and obesity kill more people than underweight. More than 400 million children younger than age 5 years were overweight in 2011. Obesity is preventable. Next is overweight versus obesity. Some confusions exist regarding the precise meaning of the term overweight, overfat, and obesity as they pertain to body compositions and an individual risk for health problem. Overweight simply refers to the body weight that exceeds some predetermined average for height. Overfat is a term used to describe the conditions of having more than a healthy amount of the body fat. Obesity refers to the overall conditions that accompanies of the host of comorbidities including glucose intolerance, insulin resistance, dyslipidemia, type 2 diabetes, hypertension, elevated plasma, leptin concentrations, increased visceral fat tissues, and increased risk for coronary heart disease and cancer. Both overweight and obesity imply a condition of excess weight of a person. Being overweight means having more body weight than is considered normal or healthy for one age or build. On the other hand, obesity is the conditions of being obese, excess amount of the body fat with a BMI of over 30, while an overweight person will carry excess weight. He or he may or may not have excess accumulations of fat. In most medical literature, the term overweight is used to describe an overfat conditions even in the absence of accompanying body fat measures. In this context, obesity then refers to the individuals as the extreme end of the overweight continuum. This is the framework used to determine body fatness using BMI. Next is estimations of body fatness using body mass index. BMI, the most common techniques for estimating fatness, is calculated as the ratio of one weight to height. BMI is equals weight kilograms per high square meter. And this is the example on how to compute your BMI. Because in 1997, the World Health Organization developed guidelines that classified people with BMIs greater than 25 as overweight and those with BMIs greater than or equal to 30 as obese. Individuals with BMIs greater than or equal to 40 are considered morbidly or extremely obese. Use of body mass index in the clinical settings. Although BMI does not measure body fat, it is considered one of the best ways to quickly approximate an individual's degree of body fatness. As opposed to looking at weight alone, it not only provides a simple baseline measure against which progress can be compared, but it also provides useful information about an individual's potential health risk factors. Limitations of body mass index. BMI is useful measures of overweight and obesity. It is calculated from your height and weight. BMI is an estimate of body fat and a good gauge of your risk for disease that can occur with more body fat. The higher your BMI, the higher your risk for certain diseases such as heart disease, high blood pressure, type 2 diabetes, gallstone, breathing problem, and certain cancers. Although BMI can be used for most men and women, it does have some limits. It may overestimate body fats in athletes and others who have a muscular build. It may underestimate body fat in older persons and others who have lost muscles. But take note that obesity is defined as body mass index greater than or equal to sex and age specific 95 percentile from the 2000 US Centers for Disease Control and Prevention's growth chart. These two individuals with differing percent body fat values but similar body mass index values. In this example, BMI does not distinguish between individuals who are lean and muscular and individuals who are obese. Those on an individual level, BMI is limited in determining the compositions of fat and lean tissues that make up the total body weight. However, at the large population level, BMI is much more effective at determining the rates of obesity. And this is the interpretations of the body mass index course. If your BMI is less than 8, it falls within the underweight range. If your BMI is 18 to 24.9, it falls within the normal weight. If your BMI is 25 to 29.9, it falls within the overweight range. If your BMI is 30 to 39.9, it falls within the obese. And if your BMI is 40 or higher, it falls within the morbidly obese. Next, health consequences of obesity. Obesity is considered the third leading cause of preventable death in the US, with smoking and hypertension being first and second, respectively. In two longitudinal analyses adjusted for smoking status, annual death rate among non-smokers was 12% to 40% higher among overweight individuals and 50% to 150% higher among obese individuals. People who has obesity compared to those with a healthier weight are at increased risk for the many serious disease and health conditions. In addition, obesity and its associated health problems have a significant economic impact on the U.S. Healthcare system. The health conditions to the obesity in children and adults increase the risk for the following health conditions. Number one, high blood pressure and high cholesterol with our risk factors for heart disease. Number two, type 2 diabetes and gallstone. Children obesity is also associated with psychological problems such as anxiety and depressions. Social problems such as bullying and stigma. Adults with obesity have higher risk for stroke, many types of cancer, premature death, and mental illness such as clinical depressions and anxiety. In the specific health risk of excessive body fats, according to the National Institutions of Health, obesity represents a chronic degenerative disease, even at low levels of excessive body fats. A moderate 4% to 10% increase in the body weight after the age of 20 years correlates with a 50% greater risk for death from coronary artery disease and non-fatal heart attack. Of particular importance in the strong associations between excess body fats and diabetes mellitus, not surprisingly, overweight children are more prone to becoming overweight adults, especially if they have an obese parents or have higher BMI. Obesity during adolescence is associated with many adverse health consequences in adulthood, even if the obesity doesn't persist. And here's the specific health risks of excessive body fat include impaired cardiac functions, hypertension, stroke, deep vein thrombosis, renal disease, sleep apnea, and pulmonary disease, problem receiving anesthesia during surgery, endometrial, breast, prostate and colon cancer, menstrual irregularities, gallbladder disease, and psychological distress. Next is the importance of the body fat contributions patterns. And individuals that have a body fat distributions patterns influence the potentials for the development of chronic disease as a high percentage of the body fats are associated with disease such as diabetes, hypertension, high cholesterol, and cardiovascular disease. This is because high level of fats in the upper body typically result in associations with a buildup of plaque and cholesterol in the arteries. These pictures is the specific health consequences of excessive affecting tissues such as the brain, heart, blood vessels, liver, and bones. This one it shows that the most common body fat distributions patterns for men and women. Overweight and obese men tend to distribute their fats around the trunk, android obesity, and the women around the hips and thighs, gynoid obesity. The android obesity patterns is associated more often with a greater risk of cardiovascular disease and type 2 diabetes compared with gynoid obesity. Next is fat cell size and number, hypertrophy versus hyperplasia. Obesity can also be clarified by the fat cell size and number. Fat cells hypertrophy an increase in fat cell size. Fat cells hyperplasia an increase in total fat cell number. The development of obesity involves an intricate process and is dependent on the interplay between adipocyte hypertrophy and adipocyte hyperplasia. Adipocyte hyperplasia represents a complex process by which new fat cells are developed from adipocyte persecutor fat cells called pre-adipocytes. Pre-adipocytes are fat cells precursors and are unimportant cell types in their own right. They comprise a significant proportions of the cells in fat tissue, often outnumbering fat cells in endothelial cells and macrophage combined. And also, they will have a two process of adipogenesis involve two major events. Number one, the recruitment that proliferations of pre-adipocytes followed by their subsequent differentiations into mature fat cells containing stores triglyceride, the major form of fat stored in the body. Two, the recruitment and proliferation phase represent hyperplasia. Next is the impact of obesity across race and sex. Because being overweight or obese increased risk of cardiovascular disease, diabetes, and some types of cancers. It follows that overweight individuals would also be a greater risk for hospitalizations than normal individuals. So that the significant differences were found in overweight and obesities by sex and race. Higher adjusted odds ratios for overweight and obesity were observed for men, blacks, and Hispanics compared to white. Asians had the lowest adjusted odds of overweight and obesity. the intervention strategies for the prevention and management of overweight and obesity in US, it should be considered sex and race is inequalities. Next is the cost of obesity will be discussed by Herdelin Lomba.